Thank you all so much for joining us. Participants, thank you so much for being speakers on this session. And for those who signed up, we're really excited to share with you all the news we've got for you on this call. As I said, I'm Ashley Stevens. I work in talent acquisition with Ochsner Health, and we're joined by a few other folks, both from Ochsner Health and from the New Orleans Career Center. So I'm going to go through and tell you who everyone is, and we've renamed their video squares here so that you can see who you're talking to when they speak. And I'll get started with Missy Sparks. She is our Vice President of Talent Management. Missy, if you want to say hello.
Hi, hello everyone. Thank you for joining us.
Next, we're joined by Shannon Joseph, and she's one of our directors in talent management as well. Would you say hello, Shannon, audibly? Shannon's not going to be on the video today. Let's go ahead and say hi, Shannon. Oops. Maybe we don't have Shannon on the audio at this moment. We'll see if she can join us after. Next, we have Ecoy Rooney, who is the Director of Nursing Leadership Development. So why don't you go ahead and say hello, Ecoy.
Hi, it is such a pleasure to be with you today.
Excited to have you all join us. Thank you so much. We also have a couple of folks here from the New Orleans Career Center. So as I mentioned, Claire Jacqueline, she is the Executive Director for the New Orleans Career Center. You want to go ahead and say hi, Claire?
Good morning, everybody. I'm excited to be here with you and talk about this exciting training opportunity.
Yeah, we are too. We're also joined by Alvin David, who's not on video, but he is going to be helping to support us by answering your questions in the live chat. So if you'll see below, there's a button to chat. And what you can do is put in any questions you might have throughout this program, and Alvin will be one of the people who will be responding to your questions. If you want to say hi, Alvin, just audibly on your phone.
Hi, everyone. Thank you for joining us.
Thanks, Alvin. We're also going to be joined by one more Ochsner person, and that is Brady Lennon. He represents talent management as well under Missy's team. And Braden will be responding to chats from Ochsner's perspective. If there's any specific Ochsner Health questions, you'll also see him responding in that chat. If you want to say hi real quick, Brady.
Hey, how's everybody doing?
Awesome. Thank you. So we'll get started. Thank you all for joining us. We're thrilled to have you here. This is a really exciting discussion in a time that I know can be very nerve-wracking and stressful. And we're here to just continue to be the community partner that Ochsner Health has always been through a really unique way. And I'm excited to bring that to you today. Now, this talk is called Hospitality to Healthcare. But this program is really for anyone, right, Missy?
That's right, Ashley. This program is really designed for anyone who's passionate about serving patients and serving our community. Right now, if you're watching the news, you see the healthcare heroes who are on the front lines and taking care of our patients. At Ochsner Health, we happen to be the state's largest not-for-profit, and we have a commitment to our community to serve, to heal, to lead, to innovate and educate. And we really want to be about saving and changing lives in our New Orleans home. We see this program as a great opportunity for those who may be experiencing unemployment right now, but want to make a difference in our community and want to use this time as an opportunity to explore a career pathway in healthcare. And that's what this program is for. Anyone who ever thought, I would love to go into nursing, I would love to be at the bedside, helping to provide care for those in need. We wanted to stand up a free program, a paid program by us for our hospitality workers who are experiencing unemployment to come into and take up a position with Ochsner Health, serving our community in healthcare.
Wow. And that's so interesting that that it reaches hospitality workers so well. I'm wondering, why are hospitality skills so perfect for this program?
So I would love to answer that question, and it has a lot to do with the fact that, you know, when people in hospitality receive their training to function in their roles, there's a lot of focus on the people that they serve. And so being in a service industry is a perfect alignment and transition and connection for using your people skills, but for really a different and a greater purpose. And so what we find is a lot of people who work in the hospitality industry already really know how to connect with people. They know how to listen to their needs, how to escalate their concerns. And I think those are some of the things that, you know, are a perfect match for what we're looking for in people who are interested in healthcare. And truly, you know, it's a way for us to partner with you to serve our community and finding ways to provide care to the community right now. The restaurant industry, for example, you know, as Missy mentioned, experiencing layoffs, and we know that there are so many ways that people who work in service, as a matter of fact, there are a lot of people who actually work in healthcare who have a background in hospitality because of the natural role transition. Right.
That's so true. I've worked in hospitality before, and I know what you're saying, that people connection, that very personal interconnectivity that you really get in incredible service environments. And of course, I mean, New Orleans has the greatest restaurants in the world and some of the greatest customer service in those restaurants. So we've really got the best group of people here to serve in this way. Now, if I'm working in hospitality and I've never worked in healthcare before, you know, this is a pretty intimidating time to consider entering the healthcare industry. So, you know, what could I expect and how Ochsner will take care of me, especially given the current COVID-19 situation?
Ashley, that is such a fantastic question. At Ochsner, our employees are part of our family. And we know that for our caregivers to provide the best care to our patients, we've got to take care of them first. So to that extent, when we knew we were going to be entering this period, that's going to be very difficult as our community faces this COVID-19 pandemic, we've stood up free childcare for our employees using kid camps, and we're able to serve our employees by making sure they can still get to work and know that their children are safe, protected. We are providing a free meal a day to our colleagues who are working in our facilities, as well as at our kid camp. So we know that we have food, we have childcare for those individuals. We're also practicing well-being initiatives. Members of our psychiatry and social work team are there for any employee at no cost. These are free services that are confidential and private, and it's really about the well-being of our team members, making sure that they are whole so they can take care of someone else. We also have an employee assistance fund where an employee who maybe has a partner or spouse who's experiencing unemployment right now may need a little extra help, and they can apply to that employee assistance fund. And it is a way that we can help to sustain our team members over this period of COVID-19. We also have one additional new member of our Ochsner team, and that's Mako. Mako is our therapy dog, and he rounds out our hospitals here in New Orleans area. And both for patients and for our own team members to be able to have a friendly dog to pet for a period of time can make a difference. So those are just some of the things we're doing now. But we do take care of our team members throughout the year. And that is through merit pay raises. It is through this December, we bonused our entire frontline workers for helping us to achieve our goals for our patient experience. So we take the employee experience just as much to heart as we take our patient experience.
Wow. I mean, that's incredible. I can say personally, I'm obviously not a frontline staff, or I'm being scrubbed today, but it's really such an honor to work for an organization that's putting forth so many benefits that are really about employee wellness, not just their safety, but their holistic wellness, and tuition assistance even for all employees. But these are really unique benefits that are so specific to the time that we're experiencing right now during COVID-19. I'm really thrilled to hear about all the things, especially the therapy dog. I think I want to be a part of that next time he visits us.
Yes,
So what exactly is a patient care tech, and what do they even do in a day?
So a patient care technician is someone who is essentially a high-touch care provider. As a matter of fact, I started as a patient care technician many years ago, and it was really, for me, a launching point for my career in healthcare. But some people, you know, remain in patient care as a patient care technician for their entire career, and it is such an honorable role. It is something that requires the ability to smile and to connect with family and really serve their needs, to listen. Sometimes people feel most comfortable talking to their patient care technician above even their nurse and physician. So it's a very essential role, sometimes even for hearing the concerns of patients and communicating those to other members of the healthcare team. You know, it's really kind of that, I think, one of the most essential roles, in that they provide you know, very intimate levels of care. They provide purposeful rounding. They connect with the team around needs, certainly connecting with the family and providing those extras. Sometimes you have a tired family member or someone who just looks sad, and the patient care tech is there to really connect and offer them a smile and a listening ear, and really giving them hope sometimes. But their role in providing the physical assistance to the patient includes things like supporting them in their activities of daily living, like hygiene and bathing and toileting. And they also really support their mobility, because that's an important piece here in the hospital. People are here because they're weak and sick, and so the patient care technician helps them with their ambulation and moving, you know, maybe from the bed to the chair, and they're trained to do so. And that all helps us get the patient home faster. You know, making sure that the patient stays mobile helps them get well better. And so you can see how essential a role this is. They really make the family and patient feel at home, and they are truly an integral part of the patient's wellness journey from the very beginning of life to the very end. And many really truly become a part of the patient's family for that time. And so it's truly a meaningful role, and one in which people can contribute to the patient's experience and the family's experience in a way that really no one else can.
Wow. I mean, that's such an integral part of a patient's experience. Even when I was a patient, to have a patient care tech help essentially guide me through my entire experience. And I don't know what so many experience right now during COVID-19, but it sounds like there's such an important role in your well-being, really, in the journey. And, you know, this is just thinking about all the restaurants or bars that New Orleanians like to frequent. I can't imagine it's that, you know, it's that different from that restaurateur that you see every week. You always go to steak night at the same place every week, right? Or you go and grab a beer after work at the same place right down the street from your house. And I know that it's got to be why hospitality workers are so well suited for this role, because they understand that level of connection and personableness that people, and kind of guide them through that discussion in their lives. You know, and I know that there are other roles similar to a patient care tech, such as medical assistant and other titles. Can you explain how is a patient care tech different from some of those other similar titles that we've maybe seen posted?
Sure, absolutely. So a medical assistant, their function is essentially in the ambulatory setting or the clinic setting. And they essentially report up to a physician. So they're part of a physician team. And in doing so, are trained differently, have different skill sets, very specific to what that clinic or setting, ambulatory setting is about. And so on the inpatient side, we have patient care technicians, and they function, as I described, earlier. Additionally, people may have heard of nursing assistant, which is essentially what a patient care technician is functioning as. A nursing assistant, a certified nursing assistant, is a title that reflects that someone has received training through a school of CNA school, and they receive a certification through the state, and really it's a license essentially to practice that is renewed through their ongoing care practice. And then nursing students actually after they finish their first semester of school that includes their first clinical experience, they can also function at the bedside as a nursing assistant.
Wow. So similar roles, but there are some key differences, it seems, specifically in outpatient versus the inpatient experience.
Absolutely.
This seems like a really great place to start a healthcare career if you've never worked in healthcare before. So what
it absolutely is. And I did want to just add in, Ashley, that, like I said, I started in that role, but it really gives you the opportunity to explore other health roles too, because you're an interactive part of a healthcare team. And so you get to see how different roles function. So if this is something where people are looking at the entry level positions in healthcare and kind of trying to determine what their next steps are, or what they want to do with their lives, their careers, this is a great place to be, to learn not only really how the healthcare team functions, but really, how to be in the presence of a patient and learn kind of what the equipment is and what the processes are and what is expected for each patient's care situation. Right.
I mean, that's great. Thank you for adding that. It's really interesting to see that your journey really started here, and now you're the director of nursing leadership and development. I mean, that's it's a great lead into my next question, which was, what can you do with this certificate, both now and beyond this role? What's really possible?
Yeah, and I think ECOI is living evidence of some of the possibilities, but somebody could come on and say, I really want to move not just into becoming a PCT today, but tomorrow maybe I want to be a nurse. And the good news about our training programs is we have a strong commitment to growing a career with us. It's not just a job. So if you come in today as a PCT, the opportunity is here for us to work with you through something called Ochsner Scholars, where we're helping to provide the tuition to grow select team members. It is competitive, but if it's really something you want, it is an opportunity that could be available to you, where we will help to grow somebody from a PCT to an RN, from an MA medical assistant to a licensed practical nurse. In fact, last April, this time last year, we graduated our very first group of 16 LPNs, and they're now working within our facilities. So there are opportunities here to grow that pipeline. In addition to nursing, to ECOI's point, you get to see more of the breadth of openings inside of Ochsner and inside of healthcare in general. So you may become an OR technician, somebody who works in the operating room. There are other pieces that could be made available to you when you get to see what you can do in healthcare. So this is a great opportunity for us to offer individuals who always thought about a career in healthcare a chance to come in and explore. And that to us would be a great piece to come out of what could be a very difficult time period for our city, for our nation, for the world. Is there's also the opportunity for us to do healthcare even better as we go into the future. And we need great teams to help us do it.
Absolutely. All my friends who work as nurses or who work as respiratory therapists, I mean, all I'm hearing now is a lot of positive feedback from them about how great their team is at all levels, in all roles. And I think Ochsner in particular, teamwork is one of our core values, and we're just great stewards of being good team members to each other. And patient care techs are the backbone of that team effort in a hospital setting. From what they've all shared with me and what patients have shared, So I think it's everything you said and the growth opportunities, it's just a really exciting time to be able to start something new for such a good cause, right?
Yeah, and it's great to be able to connect your passion and purpose to something meaningful, where you can really make a difference in how somebody heals, in how they come out of a hospital or a clinic setting, and know that you helped to save and change a life that you can't have in just any job. This is a career, and it's a vocation, a calling.
Right. Oh, that's so true. So true. I think the question on everyone's mind might be, why are we creating this program right now? What is it about the timing of this that makes the most sense right now, Missy?
I think the thing that makes the most sense is our individuals who we know have experienced layoffs from hospitality, who have always wanted to connect that passion and purpose to a career in healthcare, but never had the time to step out of work to do it. What we want to be able to do is offer a free training program where somebody who thought about that, who is now at home practicing good social distancing, can take a training online and come out of these 4 weeks where we may be isolated, practicing that social distancing, with a certification that allows them to move into a career in healthcare. So when they're coming out of this, they're coming in with a new opportunity.
Yeah, absolutely. And I know that if you are already home having to practice social distancing and wondering when your restaurant might be up and running again, this would be a really great way to use that time to open a new door. If I were, having the same experience, that's what I would be thinking. And I'm sure Claire is so excited to share with us too a little bit more about the program and this partnership as well, as she shared with me, Claire. Yeah.
Great.
I'd love to learn, Claire, let's talk more specifically about the training itself and get into how the program works. How long is that education process for this program?
Sure. So let's talk about training. This program is a unique hybrid model that prepares participants for the workforce while maintaining social distancing. So this training is full-time over 4 weeks. It's accelerated. Classes are 50% interactive with live instructors, including office hours and time for small group support, while also 50% independent and self-study flexible time. This training is going to cover the essential elements for a patient care tech certification. This includes basic life-saving, patient care fundamentals, monitoring intake and output, performing and documenting vital signs, ensuring safety checks for patients, hydration and nutrition needs, supporting mobility and ambulating patients. After earning certification, program grads will enter a clinic environment for additional on-the-job training as an Ochsner employee.
Wow. And this is completely online training, right? What if it's going to be honoring our social distancing, which we're so proud of, to continue honoring in this really unique way while opening a door for an opportunity. But what if candidates don't have access to a computer or the internet? How could they participate?
Yep. This is fully online, and we're really excited to work with folks who consider themselves an organized, independent learner. This is really a unique training environment where instruction happens at set times via online webinars, and all the materials that you need are inside a single online platform. So internet and computers are absolutely essential for this program. And if participants don't have access to a computer and internet for the weeks of training, the New Orleans Career Center can coordinate with you to lend you equipment and coordinate internet access so that everyone can complete their study and training.
Oh, that's so great. I know that is critical to being able to open opportunities for people. And while we think sometimes everyone has these tools, sometimes we don't, but they are still incredible candidates for these opportunities. So I'm really glad to hear that that's something that you've been able to accommodate for those folks. So what certification is a candidate going to obtain specifically after this training?
Sure. So participants are preparing for and sitting for the National Healthcare Association's accredited patient care assistant certification exam. This is a nationally recognized credential that represents the skills and mindsets and attributes of a patient care tech in a workforce setting.
So that really means that they can get the certificate and partner with Ochsner for their training and to do their first, their first time in working in healthcare. But this certificate can really take them anywhere, right? It's not just Louisiana. Wow.
Right. This is fully transferable and is recognized nationally as a representation of the skills that you've acquired and can demonstrate.
Wow, that's awesome. And the training is completely free to candidates. Is that right, Missy?
That is right. The training is going to be wholly covered by Ochsner. We do have some philanthropic partners who are interested in joining, which will just allow us to train more individuals for an opportunity in healthcare. And this is inclusive of all the training materials. Testing costs are included in the program. So if this is something of interest to you, I strongly encourage you to come and learn more.
Yeah, absolutely. How can candidates learn more? What's the next step for them?
So we're going to go ahead and share some information that allows folks to connect with the New Orleans Career Center and begin the process of learning more about training and how to apply.
There it is, right there on the screen. Thank you so much for putting that up there for us. So as they said, you guys, stay in touch with us. You can use that email listed at the bottom of this screen to learn more information. The folks at the New Orleans Career Center are going to be answering your questions. If we didn't get to them today, they're going to be able to talk you through what's the next step. And to my knowledge, this program will start pretty soon here, right? So we can get going pretty quickly. That's exciting. Now, I wanted to just make sure I give a chance to answer any questions that might have come through. Alvin, did you have any questions that came through that we need to bring up that would be great to answer right here?
Nope, I think folks got the information they needed. No questions on my end.
Okay, that's really great. And I don't think I've got any from our other representative, Brady, but I think I might have one more question, which is, what is the Ochsner experience? What does that look like working specifically at Ochsner as a healthcare system, in any role that someone takes? And I don't know if Missy, you might be a great person to answer this question, but if I've never worked in healthcare and I just don't know what to expect, what does Ochsner bring to the table for me?
Yeah, and I would also welcome Ikoy to answer that from the nursing perspective. I'm going to answer it from the experience I've had with Ochsner. Is that we are a family. We are a place that comes together. We have weathered storms in the past from Katrina, and we've always kept our employees whole. We've taken care of our team members so that they can take care of our patients and continue to make a difference. So it is a place that works with purpose. It is a place that lives into our values of compassion, of patients first, of integrity, of excellence, of teamwork. We're a team, so we're looking for great team members to come and be a part of us. And if you love a team environment, this is a great place to be. Ikoy, you want to add from a nursing perspective?
Absolutely. I couldn't agree more. To work at an organization like Ochsner that supports the day-to-day needs and learning needs and teaming needs, this is a place to be. I think that we are grateful for all of the ongoing learning opportunities that nurses have here, really for the career development. And as a matter of fact, in the past year, we just increased our tuition reimbursement for going back to college programs to continue your education. With the Ochsner partners with a number of universities that provide nursing programs and a number of other healthcare programs. It's very exciting, and it is a very exciting time to join our organization because we continue to grow. I would like to add that, I chose Ochsner a number of years back when I was looking for, a change. My healthcare organization had restructured, and I wanted to see what else was out there before I made the decision to stay where I was. And I was so attracted by the many programs that Ochsner has that deal with not just helping us understand, understand the patient as a person, but the mind, body, spirit connection with the work that we do. It's an honor to work for Ochsner, and I'm a very proud Ochsner employee.
Oh, same. And you all have worked here longer than I have. I was an Ochsner patient and got to experience what that hospital experience felt like and what the ethics system, at its best, moving me from facility to facility and, joining now the team several months ago, as I now have, has been, it's a true testament to our teamwork. I think, I work in talent acquisition, and so those I'm talking to every day are candidates or interested candidates. I specifically work with universities and colleges, community colleges, to help students understand both what Ochsner is looking for, but helping them navigate their own career journey. And that's really my role and my team's role. And, if I'm a candidate thinking through this experience who's never entered healthcare, I might say, well, I don't have any clinical experience. And how does this transfer well? And they're saying people skills are one of those things, but how would I prepare a resume? And if you're a candidate out there thinking that, wondering how could you possibly send in a resume that makes sense for this team, I'll just personally reiterate to you that your transferable skills you've gained working in hospitality, highlighting specifically the people interaction component of your roles is key. That's what we want to see. We want to see on your resume that you took teamwork as a point of pride in your job with your coworkers, and maybe some examples on how you could do that, or certain ways that you were able to provide incredible service to your guests, or went out of your way to resolve a conflict using really good communication skills, or the integrity to highlight something that maybe was not going so well, and you were the one who helped shed light on that. And Chloe, I don't know if you had any thoughts on, what you're looking for on a resume from somebody who might not have that clinical background, but want to try to highlight that. I've been speaking to that. I think that helped for sure.
Sure. So it's interesting because we have a nurse tech program where we bring in nurses in the summer for an intensive internship, essentially. And it's a highly competitive program, and we interview a lot of nurses. And what we found is when they bring us their resumes, they don't have healthcare experience. They've been in school. And what really attracts us when we're looking at those resumes is some solid experience in service industries. That's always very intriguing to us because we know already that they have the competence to connect. And really, human connection is at the core of providing excellent health care. The ability to listen to concerns, to listen without bias, without judgment, and just be open to what people have to say. So the highlighting your experience in any kind of service industry or service work, including volunteering, is very, very interesting to us. And as a matter of fact, I have, been at restaurants. I have been at a coffee drive-through and have paused because of the excellent service and have asked people, have you considered a career in healthcare? Because I can see in that very brief interaction that they have what it takes to care and to connect and really make a difference.
Absolutely. As a former Starbucks barista, I understand that well.
Yeah.
And restaurant, I've worked in a number of different capacities, but it's true. Hospitality workers know the better connection you have with your guests and how personable you are, the better your paycheck looks. That's such a direct correlation. But in healthcare, that really comes across as the more quality personal care we can provide patients, the better chances we have to give them back to health or improve their health or make their experience a positive one, which only leads to greater outcomes. So, I mean, absolutely right. I think if I were someone listening to this who doesn't live in New Orleans, I might wonder, you know, how could I get involved in this in the future? Or, you know, maybe I could come to New Orleans and get started and get moving. But I think it's important to tell everyone, if they don't know, that Ochsner is actually a system all over the state of Louisiana and in Mississippi. So we have over, you know, 40 different hospitals that we either own, are affiliated with, or manage, and over 200 clinics, outpatient clinics. Now, this patient care tech role is more specific to that inpatient side, so in the hospital setting. But I mean, we stretch all the way from just New Orleans, and of course, Ochsner Baptist, which is also New Orleans. But we also have locations in Kenner and on the West Bank, and now all the way up to Shreveport with our partnership with Ochsner Health. And we've got facilities in the Bayou at Chabert. Those are some of my favorite people to work with. And on the North Shore in Slidell and in Covington and in Hancock County, Mississippi. I mean, we're a really interconnected, fast-growing organization. I think it's really important for people to know, you know, if this is where you're at now, but you may want to move, or you may be open to some other opportunities. Not only can you grow in the roles and the titles and the responsibilities, but you can also grow in different geographic regions as opportunities to open up across the system, not just in your facility. I think that's critical to share. So I'm really glad that you all joined me today to answer some of these core questions and announce this really incredible opportunity. I'm really eager to see our hospitality industry that's so rich here and so talented, and people come from all over the world just to eat here and enjoy service, like at Commander's Palace Jazz Brunch. I mean, we really set the bar for the rest of the world, and I'm really excited to see how Ochsner can partner with this industry to create opportunities for those who have been recently laid off or unable to work, and open new doors. And thank you all so much for joining me, both from Ochsner and from the New Orleans Career Center. We really appreciate it. And I'd love to, for the participants who are listening in, we're going to leave that last slide up for you, and the chat is going to remain open for a few more moments. So if you'd like to ask any additional questions, if you want to write down that email address that I'll have my coworker bring up for us, that'll be there for you for several more moments when we hop off, and we'll keep it up for you, and we're eager to hear your questions. And thank you so much for joining us today to talk about this program. I want everyone to stay well, practice social distancing, and stay in touch with Ochsner. We're here for you. Thank you all.